Good evening, everyone. Good evening. Welcome to Science on Tap. Hello, everyone. I hope you all had a great summer. It's a gorgeous summer. Beautiful night tonight, but thank you for coming out and listening to us here at Science on Tap. My name is Susan Knight. I work up at UW Trout Lake Station. And Science on Tap is an example of the Wisconsin idea, the idea that the university, the boundaries of the university are the boundaries of the state. And our speaker tonight is a great example of that. He's come all the way from Madison, so it's really wonderful to have him. At Science on Tap, you won't get a lecture, but we introduce a topic and then turn it over to you to ask questions. And so this is an opportunity for you to ask all of your questions tonight. I just want to remind you about our sponsors tonight and our partners. Trout Lake Station, where I work, and Kemp Natural Resources Station, the Minocqua Public Library, the Lakeland Badger chapter of the Wisconsin Alumni Association, and our hosts here, the Minocqua Brewing Company. I'm a little out of practice, so oh well. So, but anyway, and we are also funded by a grant from the Brittingham Fund, which is a very generous fund out of the University of Wisconsin. And just a reminder that there are 4 ways to watch. Of course, you can come here and watch, which is always wonderful. You can go to the library where we are live streaming. And so you can go over there. You don't get beer, but you do get root beer, and Peg O'Connell will be your host. We also have live video streaming. So if some of you go off to warmer climes in the winter, you can still watch us live. And then we archive all of our presentations so that you can watch them later on. They take a couple weeks before they come out, but then they're out. And we also create an 8 to 10 minute short version with a little introduction, a couple of questions, and they're really a lot of fun. So hopefully you can enjoy it that way as well. So, and certainly you can watch any of our events later. So just go to Science on Tap Minocqua and watch archive videos, and you can see this one again in a few weeks, or any of our others. And we've been going quite a long time. I think this is our 7th season, or something like that. Anyway, we've been going quite a while. So our next Science on Tap event will be October 2nd, and our speaker will be Dr. Maggie Turnbull, talking about NASA space missions. We had Dr. Maggie Turnbull several years ago, maybe about 5 years ago, and she was spellbinding. She really knows all about space and moons and planets and stars. She's really fun, so I hope you can make it. Tonight we have Dr. Steve Barczi from UW-Madison, and Steve was originally from the south side of Chicago, but his family roots are from the Shawano area, and his parents lived near Sugar Camp for some period of time. Dr. Barczi and his family have lived in Madison for 25 years. They're Packer and Badger fans, of course. Who's your baseball team?
That one's a tougher one.
Oh, okay, all right. We won't press you on that one. He's a geriatrician, meaning that he's a physician who specializes in care for the elderly, older adults. But he also has an interest in the brain and in memory and sleep, all the way since he was in medical school 30 years ago. He received training and board certification in both geriatrics and memory disorders and sleep medicine about 25 years ago. And he was one of the first individuals with that combination of training in the country. And there are probably about 25 of them now, but still not too many, pretty specialized. He teaches at UW-Madison and maintains clinical practice in both geriatric medicine and sleep medicine. He loves to run, bike, canoe, fish, hike. He loves to sleep. Here's your trivia question. Dr. Barczi has raced in many events. And, well, he might be a smart guy, but he's apparently lousy at self-diagnosis because he did one event when he was badly injured. So here's the question. What event did he do with what injury? He ran the Boston Marathon with a broken leg, skied the Barczi with a broken arm, or he did the Madison Ironman with a cracked skull. Boston with a broken leg. Dr. Barczi.
I really shouldn't be admitting that one too often. I love to talk about sleep almost as much as I like sleeping. And the reality is that sleep is something that is universal across all of us in this room. And it's something that we spend, upwards of a third of our lives doing. And yet, really, if you go back 50 years, the field is relatively new. And our understanding of what happens when we sleep, how the sleep then influences many other aspects of our lives, has really only been evolving in the last several decades. So I'm going to take a little bit of time, just briefly, to talk about the overview of what is going on when we sleep, how that sleep then goes about influencing many different aspects of our body, including our brain and our memory function, heart, cardiovascular, many other aspects. And then finally make a couple comments about how one might promote better sleep. And pretty much everyone has the potential to sleep better. And I don't care how serious an insomniac a person might have been. In reality, there's a lot to the changes that occur as we get older that are blamed on just aging, but in fact turn out to be other factors. So let me shift gears then to talk a little bit about what is going on when we sleep. And I won't get too technical in jargon, but in general, sleep is a biological rhythm. Some people kind of call it a circadian pattern. And it's something that is programmed in all of us. And no matter where one lives throughout the world, there are certain patterns for when people want to go to sleep, when they sleep, and then when they get up, and then when they might want to nap in the midday. And so this is universal across the world. But as many of you in the room can attest to, we can override that biological rhythm. We can, in fact, decide that we're going to, or we have to, or something causes us to stay up all night. And so we can stay awake. Our body will not like it the next day, but we can stay awake pretty much all night. So although it's a rhythm, it's influenced by our own behaviors, and we can get into good behaviors, and we can get into not so good behaviors. So when we sleep, typically, there's a pattern that corresponds to day and night. And as most of us are aware, most people sleep during the evenings or at night. But not everyone, because we all know someone who had second or third shift responsibilities in their work. And they had to adjust their sleep patterns. However, the majority of people, typically when it gets dark out, at some point after that, we've been up for maybe 12, 14, 16 hours, and we are getting more tired. And there are certain hormonal processes that occur in our bodies that start to signal or tell us it's time to sleep. And when those patterns happen, then typically that's when most of us are starting to, kind of start to wind down and prepare for hopefully what might be a 7, 8 or so hour period where we are kind of disengaged from everything going on around us. It's not that sounds don't happen during the night or lights or other things. It's just our body has a certain unique way of being able to tune a lot of things out. And by doing that, then we're able to sleep. And when we sleep, most people are probably familiar, we have different patterns or different stages of sleep. So I would suspect most people in the room are familiar with REM, or rapid eye movement sleep. That's dream phase of sleep. And then there's deep sleep. And then there's what we'd call shallow stage. And through the night, we cycle through the rhythms where we start out in shallow stages of sleep. And then in the very beginning part of the night, the first third to half of the night, we tend to go into our deepest phases of sleep. And those deep phases of sleep turn out to be very important for other health factors and for other brain factors. And I'm going to come back to that in a little bit. But that deep phase of sleep typically is early on, and then we go into, at about an hour to 90 minutes, our first dream or REM phase of sleep. And then from that, we cycle back to deep sleep and then REM sleep and deep sleep and REM sleep. And as the night progresses, we have less and less of the deep sleep and more of that REM or dream phase of sleep. And then by the morning time, most of us are waking up, and we're waking up out of dreams because that's the phase that we're typically in. And so many people will recall the dreams that might have occurred in the final phases of the night. There are people out there, some in the audience here, that swear that they've never dreamed. And the reality is you are dreaming, but you may not be remembering those dreams the same way. So through that, the question comes up, why do we have to do this type of thing? Because I'm certain that there's a few people in this audience that would love the idea of being able to work even longer. And having those extra 6 to 8 hours being dedicated to something else other than lying there in bed and, quote, wasting their time. On the other hand, there's some of you in the audience that I'm quite certain would kill for being able to kind of protect that time of sleep. And that time of sleep is very important. And so there's a wide mix in the audience. There's also some of you in the audience that maybe get by on very few hours of sleep, 4 or 5. And some of you that if you don't get your 10 hours of sleep, you're going to be darn angry and ornery too. So there's a lot of variance in the population about how much sleep we need and such. But what we know is universal is some of the elements for why we need to sleep. So this is where 50 years ago, most people would have said, we don't really understand anything about why we need to sleep. But the reality is that we now understand there's 4 or 5 very important things that happen when our body is asleep. So one thing is that our brain, most people would suspect that the brain is kind of throttling back. It's somewhere between wake and coma. But the reality is that when we are sleeping, our brain is very active. In fact, some parts of our brain, when we do certain specialized imaging of our brain, are more active during sleep than they are actually during wakefulness. When we are in sleep, there's important brain maintenance that's happening. So all of us, all day long, we're processing all kinds of information. There's a lot of things going on. Well, the brain needs some time to kind of catch up. And so brain maintenance is one of those important pieces. Beyond brain maintenance, we also know that memory is adapted and consolidated and adjusted during sleep phase. And that's where we store away the things that are important and we get rid of all the junk. So most of us in this room probably can't remember what we had for breakfast 3 weeks ago, unless, of course, you always eat the same thing for breakfast. However, certain life events, positive events or negative events, stick. And why they stick is because they happen during the day, and then when we get into the deep phase of sleep, we actually will reinforce and kind of practice those what we call neural connections. And so those memories get stored and are stronger. And those memories actually get put away in parts of the brain that are more easily accessible. On the flip side, there are some, as I said, some things that we just get rid of because our brain just can't store everything. We can't store every noise, every sound, every smell that we've ever encompassed. Another area is immune system. How many people here have ever really had a couple poor nights of sleep and then seem to come down with the cold? Or, it's a very common phenomenon. And we now recognize that if individuals are sleep deprived, there's certain important areas of their immune system that are not functioning as well as they could be functioning. We also realize that our emotions and how we modulate our emotions are related to sleep. And the classic example of this is anyone who has not had a good night's sleep, and then the next day was just a little bit snappy, or maybe just not quite as friendly as they could have been. That's because when certain areas of our brain are well restored from sleep, they can control some of the things we think, some of the things we want to do but don't do. And that filter is weaker when we don't sleep or when we sleep poorly. There's also a few other areas, but those are some key areas that are important and that relate to the sleep process. Now, I told you I was going to cover an overview of sleep. We're going to talk a little bit about how sleep interplays with health, and then lastly talk about the promotion. So I want to shift now for a moment. And we've known over the last 20 or so years that sleep is not just important to help us to feel better, although that's an important piece. Sleep turns out to be very important, as I mentioned, for memory. And we're now starting to discover some very interesting relationships between sleep in midlife and tendency towards conditions like dementias in later life. So we're realizing that the benefits of sleep play out not just for tomorrow, but for years from now. And so, and there's other areas of brain science too, where we're understanding that poor sleep corresponds with other kinds of brain changes. Another big area that many people may be aware is now we're starting to realize that some forms of sleep disorders, like sleep apnea, if a person has sleep apnea and it's not being managed or not being optimally managed, that can set a person up for much higher chances of developing heart attack or stroke. And by treating and managing this condition of sleep apnea, we can reduce individuals' risks for having those kinds of health complications. And obviously everyone in the room here understands how significant the health impact can be if someone has a significant stroke or a massive heart attack. So we understand that sleep, and specifically sleep apnea, influences the blood vessels in our body. Another thing is that sleep influences our hormonal status. And diabetes, which is a condition where people aren't able to control their blood sugar properly. When people sleep well, they have better capacity to control their sugars during the day, and they also have a better tendency for controlling their appetite. So again, thinking of personal experiences, individuals who don't sleep well or happen to have a very short sleep phase tend to crave carbohydrates the next day more. And carbohydrates are a quick way to get your weight up a couple pounds. So we're now starting to realize that it's not just, so sleep itself can then influence our capacity to eat and controlling blood sugars, which then can cause more weight gain, which can then cause other problems with sleep, like sleep apnea. And so it gets to be this complicated cycle that unfortunately is not always good for our health. Another area of health that we're discovering is that some areas of sleep influence blood pressure control. And so people who have undiagnosed sleep problems or conditions like sleep apnea, when they have that condition and it's not being treated, it's much harder to control their blood pressure. Yet, if we can control the problem like the sleep apnea, then I have patients of mine who regularly are shedding their medicines because all of a sudden their sleep apnea is in good control and they don't need those 3 blood pressure medications. They may now need 2 or maybe even sometimes less than that. So we're realizing that sleep is more than just helping us to feel good the next morning. It's also doing a whole bunch of other things to maintain and to help with our health. Now, so at this point, there's some of you in the room who might be here for a reason. You might be here because you yourself or a loved one doesn't sleep as well. And you're wondering, well, what's he going to say? If you want me to promote that little blue pill, I will have to tell you that that little blue pill has not yet been developed that truly reproduces the phenomenon of sleep. There are a lot of sleep aids out there, prescription and things you can buy over the counter. But very few of those reproduce the phenomenon of sleep that is the normal phenomenon. Now, that's not to say that some of those medicines aren't very helpful for people sometimes. And I don't want to discourage people if, for example, that's what's helping you with sleep. But remember I said very early on that sleep is a rhythm, a circadian rhythm. So our body likes to have consistency. And anyone who's ever known a college student, or any of us who've ever been college students and abused the sleep-wake pattern, you know, the weekend didn't look the same thing as the weekday, you realize that how difficult Mondays were. Maybe not just Mondays, maybe Tuesdays too. That's because our brain can't shift gears that quickly. When we move from one area of the country to another area of the country, it can take weeks or longer for our body to adapt to that new rhythm. All of us have experienced that when we are going through something like daylight savings time change, that it's not easy, and some people will feel it much more severely than others will. But the point is that we can't expect our body to go to sleep at 9 o'clock one day and 11 o'clock or midnight or 1 o'clock the next day and kind of shift back and forth and somehow still sleep well. So that sleep rhythm, especially for those who are vulnerable and who are not sleeping well, maintaining that consistency can be pivotal. Another common thing, which all of us know, but I'm going to explain a little bit of the backdrop for a moment or so, is that napping. Napping is a good thing. I want to kind of promote napping. I think our culture should be a napping culture, and it's not. And we know that napping, if done at the right time, can actually promote learning and promote memory health. However, if we nap at the wrong time, and all of us have done this at some point in our lives where we fall asleep at 6 or 7 o'clock at night, exhausted, and then we wake up, and then we try to go back to sleep, and it doesn't happen, or not easily. So napping is a great thing, but napping for those people who have poor sleep too late in the day can influence. The mechanism, the science behind that is that as we stay awake, the longer we stay awake during the day, the more certain byproducts accumulate in our brain that are the byproducts of all of our brain function. Some of those byproducts are naturally sleep promoting. And they build up and build up and build up and build up. And when we nap, then some of those chemicals get pushed down. And so we don't have that same inertia or push to need to go to sleep then. So that's where that strategic napping comes in. Napping early in the day and not probably napping more than 45 minutes to an hour maximum. Most people would say 30 to 45 minutes would be a target nap. Because then you're not influencing some of that, you're allowing that accumulation of some of those important internal brain hormones or brain chemicals to do their work. Okay? Another area that I would say is a big ticket area is activity. So living up here in this part of the country, you have opportunities to get out and to celebrate nature and all that it offers. Physical activity plays an important role. And any one of us who's ever been sick for a period of time and you've been on your back, lying either at home or lying in a hospital bed, you realize how quickly you can get out of a rhythm. And you then sleep a little more in the day and sleep off and on in the day, and then you don't sleep in a big chunk at night. So maintaining activity, especially in the midday to 6 p.m. phase, can be very positive for sleep. Now, that's not to say that people who aren't exercising in the morning aren't benefiting. I guarantee you are. But there's a window of time when our core body temperature can be pushed up. And it's the activity piece, by pushing the core body temperature up, it allows us to then have a greater drop from our core peak temperature to a lower temperature, which is usually what our body needs when we want to go to sleep. So it's the change between the peak and the low temperature that kind of helps promote sleep, one of the pieces that can help promote sleep. And so when we exercise, we push up our core body temperature even more. And that means that can help later in the evening. So these are just a couple of examples. Now, I will say that in closing, because I want to absolutely make sure we've got a lively discussion here, there's one or two other things that you can't ignore. For a long, long time, so you're kind of wondering, hey, this guy's a geriatrician, and I haven't heard hardly anything talking about aging. Okay, so I want to point out one thing. For a long time, we used to believe that it was almost universal that people's sleep would deteriorate and decay as we got older. But I can attest to, having managed many a 90 and 100-year-old individual who sleeps very well, that it's not universal, but it is much more common that as we get older, our sleep may change in certain ways. First off, and most obviously, we don't sleep as easily through the whole night. We may find that we wake up once or twice or more than twice a night, transiently. And that is something that we notice. We also notice that we may move towards going to bed a little earlier. This is why I think the 9 o'clock news has become the big thing. In general, as we age, not everyone, but many people will have a shift to slightly earlier, some people dramatically earlier. And so that's another factor that you can see. And then the last piece is that there is a little bit of adjustment in the amount of sleep. There used to be this feeling, and it was really not well supported by science, that people could sleep much, much less when they were older. There is a tendency to sleep less, but not hours and hours less. We're talking really more like if someone was typically an 8-hour sleeper, maybe they'll be a 7 or 6.5 hour sleeper, but not a 4 or 5 hour sleeper. When you get that short, you have to explain it by other reasons than just aging alone. And that's where health conditions, medications, as well as I was talking about before, emotional factors, mood issues. People who struggle with depression and anxiety can have significant issues relating to their sleep. So when I, as a geriatrics sleep specialist, see people who come in and they talk to me and say, oh, I've been talking to my doctor for a while and they gave me this pill and that pill and that pill and things don't seem to be helping. One of the first things I'll think of is, okay, what's under the surface? What are the other factors? What health factors might be interfering? I was just talking with a gentleman beforehand about how arthritis, for example, could be, if a person's having arthritic pain during the day, don't assume that all of a sudden the brain has a magical way of suppressing that pain at night. It won't. And so health factors, prostate issues, pain issues, heart issues, fluid that builds up in the legs and then kind of wants to visit, when we get up in the middle of the night to run to the bathroom type of thing. There are health factors that can play a big role. Many medications can influence our sleep. And so it's very valuable for someone to have someone who knows about sleep or knows about pharmacology or pharmacy to look at their list and say, which of these meds could be a culprit? And that's another factor I look for. And then, of course, I look for certain sleep disorders. And that's a whole other discussion, talking about the different sleep disorders. But suffice it to say that conditions like restless leg syndrome, sleep apnea, and conditions like that can have a big impact on sleep and sometimes go unrecognized. So I've just gone through a tour de force. There's whole textbooks on sleep that are this thick, and so I've just given you the ultra abridged version. But it'll give us a chance to have some fun conversation. So at this point, I'm going to open things up to questions.
I'm concerned about a rhythm I've fallen into where I can nod off. It could be in the morning, could be in the afternoon, and it can occur while I'm driving.
Sure. And so this gets into, remember I've been talking about sleep, but really there's sleep and there's wakefulness, and they kind of have to be thought of kind of in some of the same kind of equation. And there are factors that'll cause us to be excessively sleepy or tired during the day and prone towards drifting off to sleep, in even critical situations like driving. And whenever I'm talking with a patient who is telling me that they're having excessive sleepiness in the day, then there's a few different things that are on my short list. So one of them is this whole idea of, is that person achieving their sleep need? So a person might be getting, let's say, 6.5 hours of sleep, but if their sleep need is 8 or 9 hours, then every single night they're just a little bit sleep deprived compared to the last night. And that can sometimes be a factor. But even more so, other things, like it's not just the quantity of sleep. Remember I told you that we cycle through these rhythms of sleep during the night, different phases of sleep. And if someone has a disrupted quality of sleep, maybe their rhythms are not quite normal, their quantity could be just fine. They could get 8, 9, 10 hours of sleep and still wake up and feel exhausted because the restoration of their sleep was not good. We do know, as I mentioned, a number of medications can sedate. I bet you many of people in the audience here have been at one time or another put on a pain medicine or something else that made you want to sleep. But there's other meds, too, that are a little bit more subtle that can still cause that tiredness or sleepiness. So when I kind of explore, is it the adequate amount of sleep, or is it something influencing the quality of sleep? And if it is something influencing the quality of sleep, is there an unrecognized or undiagnosed sleep process? Certainly, a condition like sleep apnea, which is a pretty common condition, can cause poor sleep quality, and therefore people wake up the next day and they are very tired, and they struggle throughout the day. And some of you in the audience are thinking about something like the Pickwick Papers or Dickens, you know, Little Joe. There was this character, he was a very big character, who had very bad sleep apnea. But as we get older, actually, we see increasingly individuals who can be quite thin, quite svelte, who still have sleep apnea. So it's more than just weight alone. So I'm just saying that when a person has that excessive sleepiness, there should be some exploration. And these are just a couple of things. But in the end, it might require someone to see a sleep specialist and even to have specialized sleep testing done to see if the quality of sleep is adequate. So, another question.
Yes, I have 2 questions. My first question is, when I go out and socialize at night and have a few cocktails, I go to bed, 3 or 4 hours later, I'm up, and then I can't get back to sleep again. That's just me, and I'm not certain if other people, I wouldn't say suffer from it, but are subject to the consequences of what they did during the night. My other question was that you said if your core body temperature raises in early 5 o'clock at night, when I go to bed sometimes my toes are cold. And should you sleep, when you go to bed, should you be a little bit warm, a little bit cold? I'll ask you.
Sure. Those are both great questions. So first off, the answer to the first question is actually it's fairly universally known. And I know I shouldn't say this in this setting, but it's fairly common for when if a person drinks alcohol within 3 or 4 hours of their bedtime. In the beginning, it's what we call a central nervous system depressant, meaning it makes us a little more relaxed, calm, even kind of tired. However, as our body metabolizes the alcohol, then we go in the other direction. And it's very common for a person to overshoot. So they've been sedated, they fall asleep maybe with some wine or beer or something in them. And then through partway through the night, as their body metabolizes things, then they actually get more charged up. And so then waking off and on during that night can be very common. So if you're a person who's sensitive to alcohol that way, and there are a number of people that are, then I just say just be careful about when you time your last drink in relationship to when you go to sleep. And the second item related to temperature. And so most of us, not all of us, but most of us in the room are going to say we much rather sleep with a window open, kind of cool, you know, and that's a fairly common phenomenon. Most people probably sleep a bit better in a cooler environment compared to in a warmer environment. And anyone who has ever lived through the middle of summer without an air conditioner can attest to this, okay? Now, as far as temperature goes, again, there are some people here that are really good sleepers. And some of these factors that we're talking about having to do with things like alcohol or temperature or even noise are just not a factor. They're going to be able to sleep well enough to not even worry. But there's another group of us that happen to have a little bit more tendency to wake up during the night. A little more stimuli can bring that on. And so for most people, it tends to be that a cooler environment is more sleep promoting, and a warm environment is a little bit less so. But there are those people out there who can sleep in just about any environment. Sure. Yes, sir. Or, ma'am.
Okay.
Sorry.
So you had talked earlier about in midlife, which I'm not sure how you would define midlife, but whatever midlife is, the need for sleep promotes memory. And if you're a poor sleeper at midlife, then what do you do for your memory later and dementia and all of that?
Sure.
Actually, I have a bunch of questions. That's one.
Okay, so people have heard that question. And again, now what I want to talk about here is that the relationships between what people do or how they behave lifestyle-wise, which includes sleep, in midlife compared to late life, are usually based on what we call epidemiologic studies. So these are big populations of people, and you kind of assess them in certain ways. And then you can say that, a large proportion of this population behave this way at this time and then develop this health problem at this time. So they're associations. We are learning from animal studies and other things, though, that if we disrupt sleep in animals in their midlives, and their midlives are different than our midlives, then it seems that they also will have certain neurodegenerative processes that might develop. So our brains can accumulate certain proteins that can be associated with conditions like Alzheimer's disease. And some of those proteins actually are cleared through a certain area of our brain during the night. And so we're now starting to realize what the relationship might be between people who consistently, not episodically, but consistently sleep poorly, and what might occur with regards to their chances of developing a condition like a dementia. Now, because this is really still fairly early within the last 10 years, it's a little hard for us to say, so do this in midlife, and that means that you will have much less chance of developing these kinds of brain disorders in later life. But we are starting to really take sleep problems more seriously because of this association. I still will say that there's a growing body of knowledge now that certain neurodegenerative processes may correspond with better or worse sleep. But it's not a one-in-one because people, there's many different contributions to a dementia condition. And so I don't want to get too far off track here, but suffice to say that our inheritance, what we do during our life, how much trauma our brain has, plus things like sleep and other factors might all contribute. So it's just, it's a multi-pronged process. So you said you had several questions.
I do, and I'm not going to try to monopolize everything.
Yeah.
But so would you recommend pharmaceuticals then, midlife, if there's an individual that's suffering?
So that is a question that I can't answer from science yet. There are some people in the field of sleep medicine that think that that's a good idea and are prescribing because of that. However, nothing is ever quite that easy, because if you know anything at all about sleeping pills, many sleeping pills actually have a contribution towards short-term memory change. Anyone who's ever taken a sleeping pill and then woke up in the middle of the night and did something really funny and doesn't remember it the next day can attest to this. So it's hard to say that the present sleeping medications that are out there would serve that need, because there's some suggestion that some of those kinds of sleeping medicines that are distant relatives of Valium might have their own contribution towards problems with brain and memory later. So right now, I think that we don't have the evidence to be able to answer your question. What I will say is that if there are other means to address sleep problems when someone might be in their 40s and 50s, see, midlife nowadays is, as we've living longer, midlife is moving much, thankfully, further along. you should be looking at all the lifestyle factors. You should be looking at undiagnosed sleep problems and other health factors that are disruptive to sleep, mood issues. All these factors are critical to address, for the purposes of sleep, for the purposes of better health.
Okay, last question, then I'll pass the mic. You had said that there's a quality hours of sleep. How, as a practitioner, do you decide or do you determine what might be the right amount of sleep for an individual?
That's a great question. And because I won't, by a show of hands, a few of you will probably swear that you can live on 4 hours of sleep a night. And you are lucky saps. But most people suffer consequences if they sleep short. When a person's trying to decide if there's something called a population-based curves, there's normative curves. So people, maybe some of you have seen that little mountain, and the mountain looks nice and symmetrical, okay? Right in the center of that mountain for sleep purposes is probably somewhere around 7.5 or 8 hours. But that means that as you move off the mountain to the sides, you will still see people who are, by all measurements that we can determine, normal, but maybe a 7.5, a 7, a 6.5 hour, even a 6 hour sleeper. Or on the flip side, you go up. So if you're someone who's waking up and you're tired through the day, more tired than you think you should be, then one of the first things we try to do is say, experiment if you have the luxury. And see, add an extra 15 minutes, add an extra half hour. If you move from 7.5 hours to 8 hours, and all of a sudden you're feeling less sleepy during the day, you're now probably meeting your sleep need. If you move up another 15 minutes or 30 minutes, sometimes this can be a process that can only be done on vacation. Because most of us have to do things during the day, and we have to get up early. But that is a way to determine where you fall on that bell-shaped curve. Any other questions? Yes?
You talked about a target for going to sleep. What is the spacing on either side of that? Would you allow a half hour, an hour?
Sure.
Secondly, I have a friend who I've spoke to sleep problems with, and he has started using CBD, liquid drops, and thinks it really works fine. I'm concerned about side effects and long-term effects. Thank you.
So the first question, as people heard, was that timing, how much variance is allowable. And I don't know that I can give you an exact number, but what I will say is that if you start deviating much more than probably 30 to 60 minutes from night to night to night to night, that's probably more variance than your brain can shift. Because just think of the example of daylight savings time. A few of you in the audience maybe feel the effects of daylight savings time for a few days afterwards, and a few of you probably barely notice it at all. But an hour is that's the 1 hour difference. Now, the second question, I can't give you probably a scientifically informed answer at this point, because the role of CBD and its influence on sleep and its influence on many other aspects of health, like pain and emotional states, et cetera, is really poorly studied. There's a lot of anecdotal evidence, meaning I knew somebody who, but as far as the scientific rigor of those evaluations are a little behind. And so most of what people are going to report about the benefits of CBD are really going to be mostly based on anecdote. Oh, I knew these 50 people or these 20 people, or this one person. And that one person, everybody knows that one person, right? So I cannot say yet what the influence of CBD is specifically on brain functioning and specifically with regards to sleep. We know that it has some kind of relaxing and sedating properties to it. And so if someone, for example, had a chronic anxiety problem and it was just hard for them to throttle down and their mind just doesn't want to shut down, then any kind of a agent that might cause them to be a little more relaxed might help. But there's still so much to be determined about the negative health consequences longer term with use of that I could never advocate for CBD at this point. Yes.
Yeah, this is fortunately of historical interest now since I'm retired and I don't have to do anything I don't want to do. But up until not long ago, I had to do a lot of international travel. And, you know, I would go to Europe, which is 6 or 7 hours one way, or I would go to China, which is 12-ish hours the other way. And unfortunately, you know, my employer would not allow me to take a week to adjust. So you get there, you know, and you're in a hotel room, and you got to get up the next morning and do something extremely technically difficult. In my case, I did survival heart surgery on non-human primates, and or else you have to give lectures at a scientific meeting. And so you lay there and you flop around because your body thinks you're in Wisconsin. And so then Ambien became my friend. Because Ambien typically will knock you out for about an hour and a half or 2 hours. But then Ambien doesn't just go away in 2 hours. And then, you know, the other option is every hotel has a bar, you know, and so you try to use that to get to sleep. But, I mean, then the next day when you haven't slept all night, you're miserable, you're probably not doing very good work. So how do you manage that? I mean, if I had to do it over again, which fortunately I don't, but I mean, what's a better way to do it? And I know you're going to tell me not to go to the bar, but I mean, you know, Merck came out with a new drug, what is it, an orexin receptor antagonist or something, and that stuff didn't work. So how do you deal with really bad jet lag if you don't have the luxury of spending a few days adapting?
Yeah, it's a great question. And if there was an easy answer, nobody would have jet lag. But what I will say is that remember how our body is, you know, kind of got these internal rhythms, and you talked about the Wisconsin rhythm. And there are individuals that promote, these are in the sleep field. We call them chronobiologists. Doesn't that sound wonderful? But the chronobiologists will advocate for our body secretes melatonin as one of a series of hormones that help us to kind of prepare ourselves for sleep. Everybody probably in this room has heard of melatonin. Well, melatonin is secreted internally, and it's secreted in the evenings at a very specific time, specific timing in relation to when it gets dark out. It's called the hormone of darkness. And they will suggest that people consider what is the time that they would be going to sleep in their new environment, and you can actually start to pre-treat yourself with melatonin. And this is not universally helpful, but for some people it can be helpful. Knowing what time you would want to be going to sleep, and then adjusting even a little bit more for that, because it shouldn't be the time you want to go to sleep in the new environment, but it should probably be 2 or 3 hours before the preferred time you want to go to sleep. There is a medicine that's much more potent than melatonin, but it's a relative been created by another drug company, and it binds to the melatonin receptors in our brain like 10 times as potently. And that agent is now it was originally marketed as a sleep aid, but now it's being remarketed, as you could imagine, for influencing circadian rhythms. And there are several others that are on the horizon that potentially will influence the clock. Light is another very potent factor that relates to the clock. And I didn't even mention that, but if we are exposed to bright light in the evening before we go to sleep, then our brain is going to think that we need to stay up longer. And likewise, on the flip side, if we're exposed to bright light early in the morning, then our brain is going to want to do the opposite, which is it's going to want to go to bed earlier. And so bright light exposure or avoidance of bright light or blue light exposure for a window of time before one goes to sleep can also be helpful as another means. And that means crazy things like people wearing sunglasses in the evening, you know, to avoid the exposures if you're someone who's sensitive that way. But there is not a universal medicine that I know of, but I said that is helpful for jet lag, although melatonin and melatonin-like drugs are probably the ones that are most strongly promoted in the sleep field. Yes?
What about any studies done on the environment that you go to sleep in?
As
As well
far
as the temperature, you know, the color of the room, soft mood lighting, or...
Yeah. So People heard, and that's another great question. So that kind of question gets back to the whole issue about what is the optimal kind of pattern for sleep for an individual. And there are some of you in this room who need complete silence. In fact, you might even wear earplugs or something if you travel and that type of thing. There are others where actually a little bit of background noise isn't so bad. This is the white noise crowd, okay? So the actual environment is highly individual. And if a person is not sleeping, then we do have them, we work with them to try to analyze what aspects of their environment, whether it be temperature, whether it be sound, whether it be light, and those who are the most fragile in their sleep, we tend to try to really protect the individuals from early morning light, because that 4 o'clock, 3 o'clock kind of dawn light can be just enough for some of us to start to want to wake up. And then we try to get that extra couple of hours of sleep, but not everybody's that way. So we think about those big 3 or 4 areas. We think about how active the brain is before someone goes to sleep. People can sometimes watch TV and be watching very engaging, stimulating things and then just put their head on that pillow and go out. But there's some of us in this room that don't have that luxury, and we have to kind of throttle our brain down over a period of hours before we finally prepare for sleep. So how active our brain is, the temperature, the sound factors, as well as the light factors, all turn out to be important. And the final factor, some of you in the room might have struggled with insomnia or chronic insomnia, where night after night after night you don't sleep well. And in that situation, there's a very interesting and important phenomenon that can occur. Because if someone lies down in their own bed, in their environment of their bedroom, which everything is familiar, and they lie there in bed for an hour, 2 hours, 3 hours, tossing and turning. And when people are lying in bed not falling asleep, most of us don't have a neutral emotional response. Most of us get a little bit more and a little bit more annoyed as that time goes on, to the point where your blood pressure and your catecholamines have kind of picked up. And so if you do that, if night after night after night, you lie there in bed and then you get annoyed, you develop this negative association between that bed no longer being that friendly place to gather respite. Instead, it becomes your enemy. And you start thinking about, am I going to get to sleep at 2 in the afternoon? Is tonight going to be one of those nights? And you spend a lot of emotional energy preparing. So even the bedroom stimuli around you sometimes can become a negative association that can actually promote poor sleep. And that's where people sometimes will say, I sleep terribly at home, but when I go visit a family member or go travel somewhere, I can sleep really well. That tells me then that they might have developed a negative association. So how are we doing with time?
We still have lots of interest.
Okay.
All right. If you typically can sleep for 6 to 6.5 hours and do fine, but then one day you sleep 8 hours and you get up and it takes you forever to wake up and it's just, you don't feel like garbage for a couple hours. Why is that?
Yep. So that's a phenomenon we call sleep inertia. So if you want to impress your friends, just say, oh, I had sleep inertia this morning. But sleep inertia is, so remember I said there's like a bell-shaped curve. It turns out it's in both, not only is it in the direction of we get too little sleep and we don't feel well, but there's an extreme. And the classic example of sleep inertia is anyone who's had a 2 or 3 hour nap. And then they just don't come out of it. The next day, the rest of that day, they're just kind of in a fog. They just don't feel like they're engaged anymore. And there are certain reasons why we believe sleep inertia occurs, but it just comes back to there's the window of, I guess you'd say, like the Goldilocks, not too warm, not too cold, just right. And that holds for sleep, too. We can oversleep. and that can cause us problems. Or if when we're in the day, in the afternoon, and instead of taking maybe a 30-minute nap, we, for whatever reason, happen to sleep a good chunk of time, 2 or 3 hours. Remember I said we start out and we go through a rhythm of sleep. We go into deep sleep, and then we go into dream sleep, and then we go into deep. So if you sleep too long, you're going to start cycling through those various phases of sleep. And if you wake up out of some of those phases of sleep, like, for example, deep slow wave sleep, then it's hard to kind of feel fully present and engaged for a while. So that's probably the phenomenon.
Is there anything you've found to do throughout the day or in your own personal lifestyle to get good sleep?
So that's a great question. And it comes back to some of those lifestyle factors I was telling you about. We know that consistency is a good thing. So trying to be consistent with one's sleep schedule turns out to be very important. Exercise can be a good thing also. Getting exposure to bright light during the day. This is a classic scenario where, unfortunately, if people are residing or living in nursing homes, and they basically are in their room all day, and those rooms are not bright, then they don't get a certain dose of bright light during the day, which helps that internal clock to know that this is day and this is night. And so being able to kind of get bright light exposure during the day is another good thing. Being careful about when I drink my last drink of alcohol can be a thing for me. Maybe not for everyone in the room, but for some of them. And then the other factor is other health conditions. So because sleep can influence many health factors, but we also know that many health factors then can come back to influence sleep. So people who might not be optimally managed for a medical condition. Or unfortunately, I'll give you an example that may be fairly common to some of you in the room. If a person goes through menopause, there's a period after menopause where their body is going through some estrogen withdrawal, and estrogen withdrawal causes these terrible things called hot flashes, and hot flashes can be very disruptive towards sleep. That's a whole other conversation, talking about how to manage hot flashes and manage menopause. But so these are just things that I would say are generally good rules of thumb for sleeping better. And then if you may have excessive sleepiness or something else that could be an underlying sleep disorder, then bring that up to a healthcare provider and talk about it. Because increasingly now we have more and more ways to manage some of these sleep disorders. So.
We have a question online.
Yes.
Yes, we have a question from the library. Can you discuss the drug trazodone as a sleep aid?
Sure. So trazodone is an antidepressant medication that is not a really strong antidepressant, but it was discovered a while ago to be fairly sedating for some people. And so increasingly it is used now at much lower doses than what would be needed for depression purposes for promoting sleep. And I want to step back and say that you'll see a lot of health providers now prescribing certain antidepressants for sleep promotion because several antidepressants can sedate. And what I'll say is that the best evidence for using those kinds of medicines are if there happens to be either an obvious mood problem like depression or anxiety, or grief if someone has lost a loved one or important thing in their life. And so we have the best knowledge saying that those kinds of medicines can be helpful for sleep if there's a mood process and a sleep problem together. Although, because a lot of the other prescription sleep medicines that are out there now are well known to cause other bad side effects like falls and confusion and things, there's been a swing toward health providers prescribing those antidepressants more often. And I do have a number of patients who've benefited from those sedating antidepressant therapies. You just need to make sure that you understand that those medicines could interact with other medicines, and those medicines don't always work for everyone. So that if someone has been prescribed that medicine, trazodone, and it helps them, it may over time lose some of its effectiveness. And in those cases, they shouldn't continue to take it at higher and higher doses, but think of other options. Yes.
I'm not sure whether I should see you or a psychotherapist, but my observation goes like this. In the daytime, it's time for work, for fishing, for doing yard work, etc. At nighttime, there is this, what can I call it, the C-SPAN book TV syndrome. There are wonderful programs on BBC Radio. Wisconsin Public Radio at midnight shifts to BBC Radio. I learn so much stuff at nighttime that indeed if I wake up in the daytime, which I generally do, I feel I've wasted part of my life. Now, how do I deal with the BBC syndrome, and or is it doing great damage to my body or my mind, and if so, which is more important? Thank you very much.
Now, that's a multi-pronged question. What I'll say first off is that there is some variance, and all of us can shift. So if you're someone who really is a big fan of some programming that happens and it can't possibly be listened to at another time of the day, then as long as the duration of sleep and ideally the restoration of sleep is there, whether you go to bed at midnight versus at 9 p.m. versus at 2 a.m., that it's not so clear that that's actually harming you. So I don't know if that exactly answers your question. The question I thought you were going to be asking me was more specific to all day long my brain is occupied by all the things I do. And then when I lie down in bed at night, then all of a sudden I'm not stimulated, but my mind just keeps going, which is a pretty common phenomenon for some people. So I guess to your question, if you're a person who's an owl versus a lark, people have heard the terms before, and these are genetically programmed. There are families of people who want to go to bed really early and get up really early, and there's families that hate to go to bed before midnight. And we don't think that those genetic variations influence the ultimate health outcomes of people. It's more, as I said, are you getting the adequate quantity and quality than exactly when you're getting it.
Question here?
Yes.
I can comment about Wisconsin Public Radio and BBC at midnight. I turn my radio on, I turn the volume down, I set it for 30 minutes, and I virtually never hear it shut off.
Sure. So that's a good sign.
So now my question is, I like to heat with wood, and so my bedroom was quite a distance away. And in the middle of winter, there are times when my bedroom will be in the upper 40s and lower 50s, okay? So if I forget to turn the furnace on, which will, heat that part of the house, I use an electric blanket. Are there any issues with electric blankets in sleeping?
Yeah. I'm not aware of any scientific investigation, so any budding person, if you know a young scientist out there, I'm not aware of that alone. There is probably, as I mentioned, there's an extreme in both ends with a lot of things, and it turns out the temperature also, if a person gets below a certain temperature, then they probably can start to shiver, and shivering isn't conducive for good sleep. But a warm bed means that you're really, what you're experiencing as temperature is probably somewhere between what the real room temperature is and what your blanket is, right? And so if you can fall asleep in that kind of a setting and you feel like you're sleeping well, I don't know that there's any reason why you'd believe there should be a negative health effect on that. Yeah. Yes.
My question is, there's been a lot of talk about pharmaceuticals, and I was in the sleep medicine field for 20-some years, so pharmaceuticals, in my experience, work temporarily, and then people fall out. And also I wondered if there's any research that has been done to show if you have that same normal cyclic when you're using pharmaceuticals.
Sure.
Because just like this, the Ambien, boom, knocks me out, 3 hours later I'm awake. Well, obviously it's not working.
Yes, so I'll address your second question first and then go back to the first. So the question had to do with the common prescription sleep medicines that are out there. And many of them, not all, but many of them kind of go into a certain part of the brain and bind to that part of the brain that actually is the same place where alcohol binds, okay? And we call those benzodiazepines or non-benzodiazepine receptor agonists, those technical terms for anybody who's technical. But suffice it to say that most of those agents will help a person get to sleep, and they will spend time in stage 1 and stage 2 sleep, but they don't tend to have as much deep sleep or REM sleep. And that may, in the long term, have effects. The other thing is, remember I talked about those medicines going into the brain and binding in a certain place. We call those places like receptors. And what we know is that those receptors are kind of like locks, and the medication is kind of like a key. And so if you take that medicine, circulates in your body, it can then kind of bind into that receptor, and then that receptor does something. As our body is exposed to some of these medicines over time, then let's just say we start out with 10 locks and 10 keys. But the longer our body is exposed to those 10 keys, the more chance it has of making more locks. And so for some, not everyone, but for some people, they can develop what we'd call a tolerance or tachyphylaxis. And so all of a sudden, that same dose no longer seems to be helping them. And then they need to be on a higher dose. You need to put in 20 locks, 20 keys to make the same effect. And in the end, that it's not a productive process because you get to doses that are too high and cause a lot of negative effects. The reason why, this is my speculation, this is not based strictly on science alone, but the reason why I believe we've not found that little blue pill yet that makes all of us feel perfect and sleep perfectly is because sleep is not a light switch in the brain that clicks on and clicks off. It's better to think about sleep as an orchestra. And there are a number of what we call nuclei in the center part of our brains that some have to be on and some have to be off. So instead of it being a single switch, it's more a series of areas in the brain that some need to be on and some need to be off. And we've not created a medicine yet that can go to all of those areas and turn some on and turn some off. And we may never, truly. So we pick medicines that maybe turn one switch on rather than many switches. And they can be helpful for some people and for some durations of time. The final, I don't know, I'm not sure where we're at with things. We're doing okay? Good. The comment I will make, though, is for anyone who's have chronic difficulties with sleep, or what I would term the chronic insomnia patient. The research that's been done on managing chronic insomnia moves much more towards favoring what we call cognitive behavioral therapy. So these are a series of different kinds of behavioral kind of psychotherapy types of approaches that when used together turn out to be much more effective over the long run than any little blue pill. So you might say, why in the world aren't everyone under the sun going out and getting their cognitive behavioral therapy for insomnia? And the problem is there's a fairly small subset of health professionals that are trained adequately and effectively in this area. We have a lot of people out there who kind of go to a weekend conference or spend a month with a specialist and then become their own specialist. And those individuals can sometimes do a disservice to the field because then someone one time did try and went to a therapist and they had a couple things done and it didn't work. And they're never going to go again when they really didn't get what I would consider to be appropriate cognitive behavioral therapy. So there are many psychologists who do get training in this area. There are some other health professionals, social workers, some kinds of counselors, nurse practitioners, PAs who get formal training in this area. And I think those people, we need more of them because they are far better the solution rather than more pills. That's my bias. Yes.
I have a question on behalf of a person who wanted to be here tonight, and so I've been vested with this question. This is from a 65-year-old man, active, healthy. Invariably at night, he will go to sleep if it's 10 o'clock or 12 o'clock, sleep for 4 hours, and then wake up. Then he has to spend an hour and a half on his iPad. Then he can go back to sleep. And his question is this a sleep disorder, or is the iPad damaging him, or should he just keep going and forget about it, not worry?
Sure. It's a great question, and it's actually a very common phenomenon. Many people will, it can be associated with aging, although it's not universally. When I hear that kind of story, I think about a couple things. So now I'm actually doing my kind of diagnosing without having a lot of good information. And this is always a dangerous thing to do. So I'm talking in very generic terms here. I'm not talking individually. But sometimes, if a person, remember I talked about the clock and how we might have a preferred bedtime? Let's just say that someone has their clock now set to be going to bed at 8 o'clock or even 7 o'clock. They start getting really tired, but they don't want to go to sleep at 7 o'clock. Nobody goes to sleep at 7 o'clock. So they stay up for 3 hours. So by 10 o'clock, they're 3 hours into the sleep cycle. They then go to sleep, and they fall asleep right away. And they sleep for another 4 hours. Then they wake up, and they're like, I'm wide awake, and it's 3 in the morning, and I don't want to be awake. In those scenarios, so one of the questions is there maybe a circadian phase shift issue here? And if that was the case, then if I was seeing that individual, and their clock really was set for earlier, and we wanted to try to shift their clock to being later, then I would have him work with a specialist who understands how to use bright light therapy. And bright light therapy can be one way of shifting that clock to later. And that sometimes can then help a person go to sleep still at 10 o'clock, but now they're really going to sleep at 10, which is their clock time, and they may be able to sleep longer. So that's one example. There are other scenarios, too. Medications. People might take medicines that are not sleeping medicines, but like we talked about alcohol, that their body metabolizes those medicines after they go to bed. And some of those medicines, if they metabolize them, just like alcohol, they can then start getting more awake. So there's a differential of things I think about when somebody's waking up in that early morning hour. Could it be medication? Could it be a clock issue? Or, there are people out there. I had a conversation before this gathering talking about how there are cultures out there that have developed patterns where they sleep for a chunk of time at night, and they sleep for a much bigger chunk of time at another phase. And that's kind of been conditioned into their pattern. There are people who might have been night workers, and if they were a third shift, you can't get that out of your blood very easily. Anyone who's ever known someone who's ever been a third shift worker, you don't just like one day retire or walk away from it, and then your body just goes back. So in some scenarios, it may be a little bit more protracted or more difficult process. So I don't know if that helps or not, but we'll see. Yes. Yes.
How do you approach dealing with a patient who has sleep apnea?
Sure. So that's at least an hour-long lecture. Or more. But so for those who aren't aware, sleep apnea is a condition that causes individuals to either pause breathing or underbreathe during the night, and it happens repeatedly through the night. And it can cause their oxygen level to drop. It can cause their brain to wake up temporarily. And if a person has many of those episodes all night long, then what happens is that their blood pressure goes down and shoots up all night long. Their body is exposed to lower amounts of oxygen throughout the course of the night. And they don't have that normal rhythm I was talking about earlier on, where you go into deep sleep and dream sleep and such. And so they might sleep 8 or 9 hours, but wake up exhausted. In the last, say, 30 years, we've started to become much more sophisticated in diagnosing this condition. And now pretty much every healthcare system has a specialist and or a laboratory that can assess this. Sleep apnea can be treated, and we've come a long ways in how we treat it, but by far and away the most common treatment for sleep apnea is using air and air pressure. And people maybe have heard of CPAP and BiPAP. There's different machines that'll deliver just enough air that stimulates things in the upper airway that allows us to have breathing that we weren't having when we had the sleep apnea. I think it's gotten a lot easier in the last 5 or 10 years of treating the process, because now we have tiny little things that stick up in the nose, or we have things that barely sit on a person's face, not these creatures that we had created 30 years ago, which strapped on people's heads and made people feel like they, were in an airport and some airplane and something had dropped down and they have to put it on them. So I do think there's a strong push. In fact, some of the most regular doctors now that refer to our sleep center are cardiologists, because the cardiologists now realize how big of a deal sleep apnea is for blood vessels and for heart and other things. I, of course, have a bias, being that I am a sleep specialist. I do think that there's a lot of evidence to say we should treat this condition. I think the way we've been treating it over the years hasn't been optimal, because we sometimes will have somebody go off to a lab, they get a diagnosis, then someone drops off a device and maybe gives them a 15 or 30-minute quick, and then they go home and they don't really know exactly what to expect, and they don't know that those first 2 weeks are the toughest weeks, and they give up well before that time. And they don't realize that we have almost 75 or 80 different varieties of masks now out there. And that we don't have to start with the right treatment level. We can start with teeny treatment levels and build up so our brain gets used to it. So there's all kinds of strategies that we now can use to make treatment of sleep apnea much more successful. And for all the reasons I mentioned before, having to do with brain health, having to do with heart health, having to do with diabetes control and other things, we really do take it seriously.
Hi. First of all, thanks for coming here. This is really kind of amazing. And so thanks for coming up here. My question, you've talked about alcohol before bed and those things. What do you think, 2 parts, what do you think about eating before bed, and how long prior to sleep should you eat? And is it normal to get up for that midnight snack or the 2 a.m. snack? And then my other part is, what's your sense of the Fitbit diagnosis of your sleep patterns?
Okay, 2 big questions there. So I'll go to talking a little bit about sleep and eating. And the reality is that there's a lot of variability about sleep and eating. And it's about as individual as I was talking about with sleep need. There are some individuals that can eat close to bedtime and not have any problems at all. There's some individuals that'll eat before bedtime and they'll have terrible heartburn that'll disrupt their sleep during the night. And so, again, this becomes, there isn't a lot of science to say you should sleep X amount, you should eat X amount of time before you sleep. Most people would advise not eating right before you go to bed for various reasons. But the wake-up piece and the hunger piece, that could be, again, when I hear that, I start to think about, well, is there an issue with blood sugar control? Is there a person who might be having diabetes and might be either undertreated or overtreated? Usually it's going to be the undertreated piece, and therefore they're waking up because their blood sugars are getting down. And so in that case, if someone has to get up to eat, but if they can eat closer to bedtime and stay asleep longer, then I'd say do that. The second issue having to do with one of these things, or something like it. We are getting more and more sophisticated with our ability to monitor external physiologic processes through wearables. That's what we call these things, wearables. And they can monitor things like our heart rate, they can monitor all kinds of different things. I would say that the early generation wearables were very, very inaccurate with regards to the sleep and their wake patterns. Some of the more sophisticated wearables that are now tracking not just your movement alone, but tracking changes in heart rate and how those changes in heart rate will be different in sleep compared to in wakefulness. Some of these are the science of the present and the future. And we are now using information that might come in from a Fitbit or other things. It's very rough information to give us an idea of what the approximate sleep rhythms or patterns might be. But it's not accurate information yet, but it's at least something. So I consider a Fitbit now to be the equivalent to some of our sleep diaries that we used to give out 10 and 20 years ago. And we know, most of us doctors know very well that you give somebody a sleep diary and they start to complete it 2 days before they're coming in. Because they've realized, oh my gosh, they asked me to do it. And it's all in the same pen. But it is increasingly, it'll be an extra piece of information we can use in the puzzle of helping people to sleep better.
We do have one more. Go ahead.
My wife and I take magnesium, and we heard through her physician that that it worked, so we're both taking it, and it seems like, if you don't take it, you're not going to sleep, so we're attached to that. And the second question is, I work shifts this summer that are 6 to 2:30, and then 7:30 to 4. I could never get used to the early morning shift, 4:30. I sleep terrible. And I hate morning. I could never get up in the morning. So once we switch and I get up a little after 6, I feel almost wonderful. When I'm at home, 7:38, I'm really feeling wonderful. But now that I'm older, I can't sleep the 10 hours or 9 hours, but I just can't sleep it. It's like getting up at 4:30 is like going on on a flight or something where I got to get up. I wake up in the night. This and that, I got older problems that make me wake up, but I'm much better off on the getting up after 6. I can sleep till 5. It seems like my best sleep is when I'm supposed to be up at 4:30 for the early shift, and I don't know what's with that.
Sure. So I'll break that out into two questions. So the first is magnesium itself. There's not been a lot of evidence to say that it directly can promote sleep. However, sometimes there are small studies that say that magnesium sometimes helps with a condition called restless leg syndrome. And restless leg syndrome is a condition where people get this funny, hard to describe feeling in their legs that can make it hard for them to go to sleep. And so I do know that doctors will sometimes prescribe magnesium, even though the evidence is not perfect. It's not, for that purpose. Now, for sleep itself, I can't quote any specific science behind that. But if it helps, there's a lot of things in life that if it helps you, then, and I don't think it's going to harm you if you don't use it in high doses, then you can stick with it. Now, the second question is a really tough question, and I'm not going to really be able to get into a lot of detail, but there are very specific ways that we try to help working with shift workers. Remember I talked to you about the internal clock, and shift work syndromes are really just a problem where our internal clock is not synchronized with life, our life at that moment. And that's where we might use things like bright light at certain times, or certain types of medicines like even melatonin and others at other times. But it's the best advice I can tell anyone who knows anyone who's a shift worker is if you can get on one shift and not have rotating shifts, that is the best case scenario. It's still not optimal, but it's better than rotating shifts. And then as far as when you wake up in the morning, that's where you might want to talk with a health professional. It could be a sleep specialist. It could be a neurologist sometimes, maybe a psychiatrist. All of them have some of this background, and they may be able to work with you on the shift work process of shifting that internal clock so that you can wake up a little bit easier at 4:30. So that's, I guess, a generic piece of advice. So.
Do we have time for one more?
All right, one more.
So I know someone that works third shift, but is 7 days on and 7 days off. Any tips on how to more successfully transition back and forth every other week like that?
Yeah, that is really tough. One of the ways that some of my colleagues who work a lot with shift workers suggest, and this is not preferred, what they'll say is keep with the night shift sleep phase the whole time. That is not very conducive to life for some people, though. But that is one way of trying to address that issue, which is just because it is the going back and forth between one phase and another phase is really hard. And even if you try to use light and you try to use the melatonin, you're not quite there. You're not going to get a complete solution there. There are some people, so the comment I will make is there are some people that are more born to be shift workers than others. Okay? Everybody knows somebody who could do third shift and they did fine and they didn't seem to ever really be bothered by it. But then there's some people that it's like moving a mountain to have them. And what I tell people, especially not so much when they're maybe in retirement phase, but if they're in earlier stages of their work life, if they're one of those people who's just terribly struggling, I might say, you know, this may just not be the best thing because some people are just not born for shift work. And no matter how fancy we try to manipulate their internal clock, we don't quite fix the issue. I know that doesn't help with your friend probably, because many times it's not like you can pick, well, if I'm not going to choose that job, then I'll choose this job. But I do tell some people that just cannot deal with shift work well that their best approach might be to explore alternative work.